Hi, I'm Dr. Steve Ratcliffe, part of the resident faculty here at Spear Education. Today's Lunch and Learn is the power of photography. At the end of this Lunch and Learn, and when you're done with your discussions, I hope all of you on the team will understand why we use photography. You'll understand at least some of the pictures that we use on a routine basis. And I also want you to talk about who's going to take the pictures in your office. Photography is without a doubt the single most powerful tool that we have at our disposal to help our patients make choices about their dental health. It allows them to see themselves in ways that they never have seen themselves before. It allows them to really see conditions that we identify. You know, it's one thing to give a patient a mirror and ask them to look at something. It's another thing to take a photograph and then blow it up on a screen so that they can see the entire arch. Digital photography is also probably a tool that is better than the intraoral camera that many of us use. And the reason that I say that is it allows us to look at our patient with very clear images and allows them to see their whole mouth rather than focusing on single teeth. Showing your patients photographs like this, for instance, a close-up of the 6 front teeth, allows you to talk about things like the wear facets that we see here. Oftentimes, people aren't even aware that these changes have occurred over time. So showing them in a very large way allows them to begin to think about what's really happening in their mouth. Of course, photographs are a permanent record that accompanies the charting that we do for our patients. And personally, I like to have the photographs because they give me much more information than the chart notes that are either on my computer or handwritten notes that we sometimes do. Another great tool for photography is to allow us to evaluate the quality of our work. And that's true for anybody on the team that works clinically with our patients, whether it's me evaluating my preparations here, or it's photographs after somebody in the hygiene room does a scaling and root planing, or perhaps provisionals that are placed in the mouth and you take some photographs afterwards and you really get to enlarge the photo and see how you've actually done. So one of the questions that always surfaces when I'm talking to people about photography is, who takes the pictures in the office? Should it be the dentist or the dental assistant, the hygienist? My answer is it should be anybody in the office who really has an interest and thinks they can do it. If you get to do the things that you like, you're going to do them better than if you feel like you're being forced to do something that you don't like. So talk among yourselves and figure out really who has the interest to take pictures. Now the other thing is, what pictures do we take? Now this Lunch and Learn is accompanied by some other courses in our digital suite that you can look up and follow as well. When we have people in our facility at Spear, we teach this series of 18 clinical photographs that gives us a complete diagnostic record for our patients. But I really think that there are 6 basic images that you can take routinely for your patients that will show them every surface of every tooth and allow you to really begin to have conversations that are meaningful. So the 6 images that we suggest are a natural smile shot, and I ask my patients to exaggerate their smile. Then I use retractors and pull the lips and cheeks out of the way and ask them to separate their teeth a little bit. I take occlusal shots using mirrors, and I take shots with another mirror called a buccal shot with the teeth apart. These images allow us to see all of the gum tissue around the teeth and its relationship to the teeth. It allows us to see the drape over the teeth, the lips, and their relationship to the gum line and to the edges of the teeth. It allows us to note things like broken fillings or cracked teeth or wear patterns on teeth. It allows us, in this case, to see spaces between teeth and begin to have conversations about that. What I'd like you to do is think about when you could take these images in your practice. I've included a discussion guide with this Lunch and Learn that will guide you through some of these things. And I think that you will find that if you set a goal to take at least these 6 basic images for every new patient that comes in, and then think about the patients in your hygiene room where you could take these images, you're going to have people accepting better dentistry and more dentistry. Thanks for being with me.